A 28-year-old male with history of foreign body in his right foot on plantar aspect, for which he underwent surgical removal with incision wound, and after that he went home, and 2 days after that he presented to emergency with complaint of bilateral lower limb swelling and fever. We looked at the wound. There was no pus, no discharge. It was not looking infected. We sent basic labs, and TLC was 23,000, platelet was 58,000, CRP was 46 mg per deciliter. So lab was showing picture like infection, bacterial infection, counts are elevated, CRP is elevated, but wound is not infected. So we looked at other sources, chest x-ray, urine REME, it was negative. Then we sent USG. USG was also not significant. There was no focus of infection in abdomen. We sent LFT. LFT was total bilirubin was 12. Conjugated bilirubin was 6, ALT was 100, AST was 185, and alkaline phosphatase was 2 times elevated. So it was looking like cholestasis. But USG was negative. There was no features of any biliary obstruction, but LFT picture is looking like cholestasis. And for bilateral lower limb swelling, we did echocardiography, which revealed LV global wall hypokinesia and ejection fraction was 35%. So we thought that there might be some infection, any bacterial infection, occult infection that is causing sepsis, leukocytosis, thrombocytopenia, and septic myocarditis along with septic cholestasis. Because in sepsis there can also be the picture like cholestasis, but we could not find the source of infection. Then as LFT was deranged, so we sent viral hepatitis A IgM and it was positive. So why do we need to distinguish viral hepatitis from other bacterial infection? Because viral hepatitis does not require antibiotics, just only supportive management is required. So as it revealed viral hepatitis presenting with myocarditis, thrombocytopenia, leukocytosis, elevated CRP and cholestasis pattern of hepatitis. Generally in hepatitis, what occurs that in viral hepatitis ALT, AST are elevated in thousands, and total bilirubins are unconjugated bilirubin are not elevated like this. This pattern is present in less than 5% of patients with viral hepatitis. And this is the reference, I have taken this reference from UpToDate, and you can see it is written that cholestasis pattern of hepatitis A is seen in less than 5% of the patients. So why I am telling this? Because we should be cognizant, we should be knowing this pattern as well, because this pattern can be confusing and we might start antibiotics that is not beneficial and only cause antibiotic resistance. So we admitted him and managed with supportive treatments, and after 12 days his total bilirubin was 8, conjugated bilirubin was 4, ALT was 310, AST was 149, alkaline phosphatase was 8 times elevated, gamma GT was 5 times elevated. So in 2 weeks span you can also see that there is still cholestasis pattern. And you can see this reference from UpToDate. It is written that cholestatic hepatitis, it can remain in this pattern for greater than 3 months, even greater than 3 months. And here you can see it is also written that total cholesterol can be elevated. In our case also total cholesterol was 239 and LDL was 171. So we should remain cognizant of this pattern of hepatitis as well.